Thanks, George. And I think that's a wonderful way to come to the end of this session. And before Lisa comes up, one or two comments. I mean, I think anybody who's been reading Claire Wang and colleagues' work from Columbia and other places reminds us very well that actually the size of the energy gap we have to reduce to get the population back into energy balance, if you actually reduce it to the calorie shifts per person per day, is not huge. It's doable. And some of the elements we saw up there would help people actually get to that level. Of course, for those who are already at very high levels of body mass index, it would be substantially larger. I mention that because applying what we already know probably would get us a long way there, and many of those pieces are already in place. And some of those mid-level things, we know there is actually a movement out there for meatless Mondays and many other related efforts that vegans are proposing as well, that all add to this general progress. And what has this got to do with the focus on environmental sustainability? Well, we know that reductions in supersizing and overconsumption will obviously be equivalent to saving food waste and have enormous implications for freeing up land that is currently going into fueling the obesity epidemic and some of the food waste issues. Always think back to the power of some very simple incentives. Those people who did medicine probably can recall the era, which was not long ago, when I think one of the cheapest and most effective incentives that I ever saw used had impacts on billions of dollars of profitability. And it was called a pizza delivered at the right time of the evening when somebody is working the rounds of a hospital, provided by a pharmaceutical company, and with very little else added. But the cozy relationship then established between prescribing patterns translated into billions of dollars of profitability for the pharmaceutical industry and led to the abandoning of the use of pizzas, which was seen by the doctors and physicians on the floor as being something they didn't want to give up, even though the cost of it, the actual monetary value, was so small. The symbolic value and the way it was delivered, as George was saying, was so perfectly timed at a point in your day when you were exhausted or hungry that you were willing to accept it and actually support those who provided it. I think that's an example of an incentive that may have had a perverse long-term effect, but I think many of the others could actually be better aligned. I think we also learned, and I think George's last framing words were really important, it's not a question of either or. I introduced his sections talking about the need for some very strong policy direction that takes in government, takes in industry at the highest level and gives clear direction. Without that, we will not see substantial progress. But we also will not see some substantial progress if we don't have every person engaged in ways in which they can actually see the value for their own lives, and if they can't see it directly, are encouraged to go in that direction and hopefully at some time they would. Their full engagement and the engagement of the policymakers thought through in a synergistic way, I think, would have a much more powerful effect. And one of the examples would then be to ask the question, how do we realign the role of government with the role, in this case, of some of the NGO and industry-related activities so that you can achieve optimal and sustainable diets for all? And that is a debate that I think we've got a lot of fuel that's come out of this meeting to guide us. Clearly, it's the role of governments to set broad policy frameworks, to look at some of the removal of structural impediments on the subsidy side that are either wasteful or driving us in perverse ways, the whole use of incentives that are not aligned with common goals of sustainable diets. That clearly is a central role of government, and not only getting it right on the financing side, but talking about it far more in the public domain, being far clearer about informing the public about what is a calorie and why does it matter in your lives, in the ways in which we saw synergy between the pharmaceutical industry and governments way back, people were informed about what is cholesterol, what does it mean, before the statin manufacturers could sell any statins. Well, we're expecting people to be eating more fruits and vegetables or lowering the salt or eating healthily without them having the overhang of very strong government-led voices on what is the reason for actually making these changes to you and your material for your health and for the sustainability of the planet. So I do think ending with that note on better linkage is exactly the right note to leave us with. So it's now my final job to really ask Lisa to come back to us and to give her reflections on day 2 and hopefully some of the ideas about what we're thinking about for the future. Thanks, Lisa.